guys, it's Anthony here from Medical Fitness and Wellness Group, and today we're going to go over some KT taping techniques. We're going to do neck and shoulder, then we're going to go into the lower back and also the IT band. We have Dexter here who's going to be our little demo guy. Alright, so the first thing we're going to do is we're going to work on our neck and shoulder. So for the first step is we actually have to clean the area, so we actually use little alcohol wipes here just to take off any dirt or oils that the person might have. Once we did that, we go ahead and we get our tape. I'm using RockTape here. We go ahead and just measure it. We want to be about 1 inch to the side of the spine. So what we could do is we got it about right here. We can just fold it, pull it here, just like that. That way you go ahead and have 2 strips. Use some scissors, and you cut it right there. Now once you cut it and you have your 2 pieces like this, you want to go ahead and you want to round all the edges. That's actually going to help the tape stay on longer. So here we have a closer view of his actual back. So what we're going to do is we're going to peel it just a little bit, and you're actually going to put it down about right there with no stretch. And then you get the other one and you do the same thing. Remember, no stretch. Because all you're doing here is just giving a little bit of stability. And then you want to get a strip that we're going to go ahead and put here. So same thing, we just measure it. That should be about a good length right there. And we go ahead and we just cut it. Don't forget to round your edges. So here you're actually going to want to do the same thing, but you're going to put no stretch here, about 75% stretch here, hold it, no stretch. And then you just want to go back, rub it on, make sure it sticks. Okay, so now we're actually going to do the lower back. So same thing. You actually want them to be kind of in a laying down position so you can have better access of all of the back muscles. So you want to get your strip and kind of measure it here. You want to be about 1 inch away, just like we did with the upper. So that should be good right there. Same thing. Pull and fold it so you can go ahead and have a good length here. So we have this. Don't forget to round your edges. Alright, once we have that, we go ahead and get the strip. Peel off just the tip. You don't want to get that on your fingers because then it gets really sticky. Or you also don't want to fold it once you've already done it. So you're going to just put it down here. No stretch. You could do a little bit of stretch or no stretch, kind of depending on where we're at. I would say here on the lower back, I would do about a 25% stretch. So that looks about that right there. Make sure you don't get any wrinkles in there. Hold towards the end. No stretch. Perfect. Same thing on the other one. You want to get about 1 inch away from the spine. No stretch on the top. You can do about a 25% stretch. Towards the end, no stretch. So Dexter was complaining about pain right in this area. So the final strip we call the decompression strip. So we're actually going to go ahead and put it right over the pain area. Again, round the edges. And there's different techniques you could do. You can actually rip it right here in the middle and then push this way. I actually find it better when I just do this. Same thing. So, right here, no stretch. Pull it at about 80% stretch. As you're pulling, push down towards the end, no stretch, and just release it. And that's the lower back. Alright, so now we're actually going to do the IT band. So you're going to want them to lay down sideways and then go ahead and expose the IT band. Don't forget that we have to clean the area before we even put the tape on. So once the area is clean, you go ahead and you get your tape and you measure it right there, right along the IT band. Cut. Don't forget to round your edges. Just peel it. So you go ahead and get it right about there. No stretch. All the way down. No stretch. And then you're going to have your decompression strip that goes right here. So you go ahead, you measure it. And then once you get it here, you put it down, no stretch, and you pull at 80% stretch all the way down, and then no stretch towards the end. And that concludes the IT band.